Senator Francis Heyliger, you're recognized for your 5 minutes. But I
Yeah.
believe we lost Dr. Flippin, Senator. So
Okay.
I'm not sure if you want. Let's take a quick break, or you want to proceed until she gets back on. It's up to you.
But I'll proceed. I do have some questions for her. I guess I could proceed until she signs on.
Okay, thank you. Proceed,
Okay,
Senator.
no problem. The first thing I would like to ask of the testifiers, good afternoon once again, as to the legality of merging boards, whether temporarily or otherwise. I'm trying to, for me, a lot of times I like to do things correctly. So I need someone to explain to the legal aspect. Can we merge multiple boards together, even if it's temporary? Through the chair, could we get some legal response in regards to that? But I'll carry on otherwise. As it currently sits, with the question of how to, for example, with podiatry, how to get a quorum on that board, it it says from what I understand from all the testimony, it says at least one. So based on what was just shared from the Department of Health, there are 5 licensed podiatrists here in the territory. And we clearly know, based on our population, we're not going to have hundreds of them here. So if you have 5 individuals already registered and have licenses here in the territory, and the other requirements to be on the board, would it have not been easier to just try to appoint at least one of those individuals and get the other required individuals that apparently we have readily available, as opposed to trying to create a whole new bill? I'm trying to understand the logic in what's happening here, because I think a lot very logically, and I'm confused at the purpose of this. So if anybody can explain that to me, Commissioner Encarnacion, Dr. Odlum, someone, because I'm trying to get it.
I can start, Dr. Odlum, if you can assist as well. But we're really trying to really get over the hump. That's basically what we're trying to do. And as Dr. Odlum has says, the VA Board of Medical Examiners is not going to take over podiatric credentialing unless at the time, at this point in time.
One second. That's not what I asked. I understand what you want to do.
No,
I'm asking the necessity of doing it if you already have the capability to just appoint people to the board. That's what I'm trying to understand. Why is that part not being done?
I would have to actually vet the candidates to see whether or not. Remember, we have 3 that is of our island that's not practicing locally. We have 2 that are practicing locally. One, of course, is already there for the board, but the other one isn't. I would have to refer to Director Richardson Peter to see whether or not those individuals denied being a member of the board. That might be one of the areas that we need to focus on as well.
Okay, so based on what you're saying, somebody is already assigned to the board, at least one podiatrist. So are you saying that requirement has already been met?
I would refer to Director Richardson Peter so that she could give you that information.
Okay, thank you.
Good day. Currently, there are only 5 licensed podiatrists. Board membership does require residency, and out of those 5, there are only 2 that are local, which is Dr. Flippin and also Dr. Ian Cook.
As of right now, the board does not have a quorum. Is any of these 2, I think Dr. Flippin said she's not one. Is the other individual assigned to the board?
No, there's no one on the board currently. The last board member that was assigned to the board was Dr. Kenneth Fox, and he retired. So there's no one on the board currently.
And the other question, in regards to the 2 that have residency currently, because we stress that our population is small, so we don't expect to have a lot of them here. I also heard in testimony that there potentially might even be 8 more trying to get into the territory. Have any due diligence or any type of investigation or consideration has been made of the two that currently live here to see if your desire or it was applicable for them or either one of them to meet the requirement to be on the board? Has anything been done even with the two that are residents here?
My understanding is that Dr. Flippin has submitted her application to serve on the board several times. However, the board members are appointed by the governor, so I am not privy to what has happened since that time.
Other resident, have they ever applied, or just her?
That would be a question for boards and commission. I'm aware of Dr. Flippin's application because it came through our office at one point, but I'm not aware of anyone else who applied. Individuals can apply directly with boards and commissions at Government House.
Okay. So is there anyone here that I could find out if the two residing physicians that are podiatrists had applied to be on this board?
Can you
as to why this particular board is not being filled? Because clearly there are already rules, regulations, and laws that exist. So I'm trying to understand what is happening, why the mandate is already in the code, but for some reason the trigger is not being pulled to do what needs to be done. And the only solution that we're coming up with, as opposed to actually doing what the code already says, is to create a whole nother law. That's what I'm trying to get at.
Senator, if I may. This is Odlum. The other members for that board would be physician. If Dr. Flippin had applied, and let's say she was granted, that would still just give you one member to that board. And then the other applicants would have to be physicians. The Board of Medical Examiners isn't even complete. And so it's not, I mean, we have a new member on our board, and I know hospital board, I mean, we got new members. So I think there have been people being appointed, but you don't have a bunch of people running around wanting to be on board. So the governor or Deborah or I can ask, I would love to have, I need another physician from St. Croix, and we need 3 public members on our board. And we have never to date had a public member volunteer or even request to be on the board.
Well,
so that's,
for me,
it's not that the legislation does exist.
But quick question, with the legislation already in existence, the physicians to meet up outside of that one podiatrist, even if we combine and create this whole thing, you still have to look to physicians and other individuals you have to gather to create even this temporary board. So it'll still boil down to me, why not ask those same people to go on this board? It's the same thing outside of meeting the mandate for the one podiatrist. But quick thing, legal counsel is here. I want you guys to know to respond in regards to my question as to the legality of trying to merge all the boards. That's all I needed to find out. But you could answer before they respond. Thank you.
No, I hear what you're saying is like take the same medical board members and make them part of the podiatry board. Basic, you know, as if they want to be on it. Our desire, quite honestly, we didn't have one. It was more if there's people who were applying, you didn't have a quorum, and once you have your folks in, or once the governor is able to populate the board, then we're out of it. You ask a good question. It's just not I don't have the answer. I don't necessarily want to be on another board, so to speak.
because that's what is really confusing me here, because I'm of the same Nike thought process. Just do it. I don't understand what's happening here. But I would like legal counsel to explain as to the legality. And I think my time was called, so I should be finished.
Thank you so much, Senator Francis Heyliger. Senator Francis Heyliger, we good?
If we're good?
Yeah.
In regards to the drafters, no. Well,
Yes.
so we don't need legal counsel. We're just going to go based on what was written. That's
Yes.
all I need to know.
Yes.
Okay.
Thank you so much.
So I just want to make one more statement.
Sure.
So if we already have the legal counsel saying that it might not be in our best interest to do this, and we're potentially going to create another level just to do something that's already on the code that we just need the governor to execute. This is too much. But thank you so much.
Okay, thank you, Senator Francis Heyliger. Point of information. Senator Francis Heyliger.
Thank you so much, Mr. Chair. I just wanted to put on the record that as I sit here and listen to this debate back and forth, I'm going to be honest with you. I am 100% in favor of just scrapping 340042 and going with just creating something temporary so we can get to the next step. There's too many things inside of this bill in the attempts to merge boards, try to do things independently, put medical examiners. It's too much for me. I think I am one that believes in simplicity. And if we could come up with something temporary, just a paragraph or a few lines in order to give the authority temporarily. And I do agree with a potential sunset clause. And if it does not get enough people in that time frame, we could go back. We're the legislature. We do it all the time for a variety of things. If we give something a timeline, if the governor does not do it by 180 days, we've gone back and altered the law to give them additional time. When it comes to our state of emergency, if things are not done in a time frame, we have the right to go back in and give the extension. So I don't understand a lot of the back and forth about this. Clearly, this was a piece of legislation, from my opinion, that is masking some issues that are happening here. I personally don't want to participate in the unnecessary back and forth of it. So I am in favor of something temporary and moving us further along to get the people here, the doctors here, to service the people of the territory. I just wanted to put that on the record. Thank you.
Thank you, Senator Francis Heyliger.